can poor posture cause lower back pain? Can it cause you to feel in tremendous pain and not being able to do the simple things in life, like being able to get out of bed in the mornings, being able to take that walk in the afternoon, being able to sit down, stand up, work properly, and do the daily activities that you need to do? Hey, my name is Michael from Remove Back Pain, and in this video, I'm going to go ahead and exactly tell you and show you whether or not poor posture is causing your lower back pain. And if you stick with me to the very end of this video, I'm going to give you 3 tips on how you can improve your posture for long term, right? Not just these quick, short-term conservative treatments, painful medication, opioids, and so forth. Okay, so I'm going to be going over all of that. But if this is the first time you're watching me, I come out with videos like these on how to improve your back pain, lower back pain, how to get back to work, and how to just improve yourself mentally and physically, eating better, and all these other different assets that I speak about. So make sure you go ahead and subscribe first and foremost so you don't miss a thing from me. And you can also view my other videos. I'll have more of them down below in the description. In just a second here, I'll be going into a share screen, showing you an article that I put together, so that way I can go and break it down step by step through there, and you and I can follow along, and I'll reveal to you the things you need to do. But most importantly, I'm going to tell you this right now, and I'm going to cut to the chase. Yes, poor posture will cause you to have not only lower back pain, but upper back pain, thoracic pain, and it's going to cause a lot of pain leading up to your neck, right? Cervical pain as well. So not only lumbar, thoracic, but cervical pain too. You got to be careful. And, one of the things that causes you to have repetitive pain in posture, and I'll get into that here in just a second, is that your motion of your body is one thing. You're usually, if I'm sitting down right now, as I'm shooting this video to you, I'm doing my best to keep my head forward, my back straight, kind of pressed a little bit against the back of this chair as it is, but not enough to the point where it's like getting me too comfortable where I have to sit back. And that also has to do, if you're in a seating position, it has to do with the chair is one thing, but also if you have other stability around you. So it's ergonomics that's very important. I'll be breaking that a little bit more down here in this article. So make sure that your spine is straight, and you do that by keeping your back straight, a little bit back here, head forward, chin straight, neck straight, and that's what's really going to help. And then the shoulders are aligned perfectly, and that's going to cause a good degree for you to be able to have good posture. And I know one of the big problems I have, and I had, is being able to sit properly. And, for those that know me, just quickly, I dealt with pain myself, ex-Division I athlete, soccer athlete, having pain myself, going through acute, chronic, herniated disc pain, sciatic pain. I know that there are many short-term reliefs, and that these only last for so long until you get to a point where it's like, what else is out there? And I'll also be revealing to you what you can do. But most importantly, you have to condition your back. Your back needs to be more in condition. And so it takes more work to do this, right? It takes more work just to keep your back straight, but it's going to go a long ways. Even if you're standing, in whatever it is you're doing, you're walking, you make sure you keep your posture straight. But we're so conditioned to just do this. And so what happens is our back is now caving forward. If I'm turned here a little bit to the side, what's happening is you're going forward like this. And so now your neck is facing forward, and then your shoulders are leaning in, and then you have your back leaning forward, thoracic, and your neck now is going up, and now your lumbar is going to be kind of caving in towards your abdominals. And what you're doing is called a kyphosis. You're going ahead, and the normal curvature of your spine isn't aligned as it is, and so it's curving in, which is like a curvature is what we call it. And so it starts to curve in, it gets into your abdominals, and that's where it starts to cause a lot of pain. And then you have poor decondition. And I'm going to tell you right now, the biggest reason for that is because you have a muscle imbalance. And I'll be covering that in this article a little bit. So let me go ahead and get into it right now. So I created this article for you. You can gain access to it down below in the description. Once you're done with this video, you can go ahead and go through it. So can poor posture cause lower back pain? I answered that yes. and I'll be revealing the top 3 tips on this. So stick with me to the very end of it. It's an of course answer, right? Or is it? You know, believe it or not, this is not only a one-way road. There are quite a few, in fact, more solutions than just one to answer this question. What if I said there were 2 of them, right? You only think about it as poor posture is causing my back to hurt. But what if you thought about it in a different way? There are more reasons to it. It's also a bad back is causing your poor posture. Okay, so you know, many of us, if you have an injury per se, right? It's not something that's developmental, meaning that it's not progressing. You're not like at this stage where you had an injury and then, you know, your back just was in poor posture. You were developing it over time. Most people develop it over time. And so they go in these bad habits, right? Like sitting, the way you sleep, standing, the way you arch your back when you're doing things, picking up things in the house, stuff like that. That's what will eventually cause you to have poor posture, meaning that it'll cause lower back pain. But when you have back pain, that can cause poor posture. So if you have an injury, if something very bad happens, then that will then result in you having poor posture. So you can look at it 2 ways. So there's a 2-way roads. I talk about this. There's also a 5 steps to managing back pain daily guide you can get in here. I think it's a very long article. It's a very long like guide and ebook that I put together for you, how to manage it 24/7, 7 days a week, Monday through Sunday. In your circumstances, it took me a while to put this one together, but you can get it for free. It's a very nice one. So poor posture equals LBP, lower back pain. And so what I'm going to be talking about here in this article is what is the meaning behind posture? How does it happen? Why does it occur? The 4 steps to correcting your posture, 3 steps to maintain it, 3 tips for long-term better posture. So again, you can follow along if you take this article on your own time. You can go ahead and do that. But I go ahead and break it down. A big reason why you are having poor posture, okay, is because you're dehydrated. So that'll also be one of the ways I talk about how to fix it, but dehydration, and I have other videos on this, like how to fix lower back pain in 4 minutes and stuff like that you can view. But you want to be able to dehydrate in the mornings. And the way you start your morning is the way you're gonna finish your day. And the way you want to start your mornings is with a routine. And this routine is something like drinking water in the morning or drinking water with lemon, because it'll bring more of the pH levels and the acidic levels to neutral with your pH, with your acidic and base. And so you want to keep it neutral. So you want to drink water, and it'll also hydrate your discs in the back. And that way it will be able to go around your muscles and joints and be able to give your spine more strength and, more importantly, the flexibility that it needs. Okay, so you operate on different strengths, and nutrition is going to help because the blood flow is going to be coming to it. It's going to give you more power, and it's great for any kind of spinal conditions that you're going through. Okay, kind of talk about lessons learned under the pressure. You know, so here's one of them. The continuous physical force exerted on or against an object by something in contact with. That's kind of what I break down in terms of having pressure. So a lot of the time, why you have poor pressure is because you're fighting against another object in place, right? Something of an external force that's pushing you. Whether you're just standing up and walking, you got the ground up against you, and whether you're sitting down, you have a chair up against you, you have a bed. It can be all these different forces that are causing you to have this exerted amount of pressure on you. And when that happens, you're going to have an imbalance. Okay, so a lot of what we do, I'm a victim of this. I corrected it over time. I realized that my poor posture was as a result of my lifestyle, my choices that I was making. And I knew after I had so much pain after herniated disc and going through all these different treatments, trying to treat it, and it wasn't working. I got in contact with a friend of mine, and he, started telling me about different ways about going about it more naturally. So I have other articles on that in here that you can view on your own time. I'll link to them. But for conditions such as rheumatoid arthritis, spinal stenosis, spondylolisthesis, it's very, very important that you stray away from doing anything repetitive that requires you to bend your upper back. because this can worsen your condition and press more stress to your discs. So you want to be careful with these kind of conditions. You already have some spinal issues coming along, so you don't want to cause anything more to your upper spine, which will cause more down to your lumbar. Be careful there. Who and what is working harder? When you have a poor posture, what works harder? Okay, it's not exactly the spine that's always working harder. If you notice, maybe it's more about your hips, your hamstrings, your thighs, your pelvis. All these different muscles around the spine are working 10 times, 20 times harder. And that's the truth through my own experiences. I know that. After sitting down a lot, I had a cubicle job where I was sitting down a lot, and I was wondering why I was in so much pain. I wasn't getting over it. Taking short-term medications, doing conservative treatments. I'm actually sitting on a lumbar seat cushion for my buttocks. It's very nice. It's one thing that I've made an adjustment to, of many. But those are the things that work harder. Your hip joints, your glute, especially your glute muscles, they get so soft, and then you have a weak muscle imbalance. It's likely that both of them are going to get weak. Your hip joints, one side will get weaker than the other right away, causing you to have an anterior and posterior pelvic tilt. So you got to be careful for those things. And those are the reasons why your posture suffers, because you're either tilting forward or you're tilting back. Right, you're in anterior or pelvic or posterior pelvic tilt positions. It's causing your back to hunch, causing that spine to go out of an alignment. Okay. Hips, glutes, facet joints. I have videos in here you can view. I talk about how you shouldn't be using your back. Don't be slouching on a chair, which is kind of what I covered in the beginning. You can view this again to go through it. Tension equals pain, right? Your muscles have a lot of tension. That's why they're in weak imbalance. We need to get them conditioned back to a better balance, okay? And no matter, and I talk about this in other things, in other videos, in my articles, that no matter how much you can exercise sometimes, no matter how much you go and stretch, no matter how much you go for that jog, that run, play a game of soccer, whatever it may be, it doesn't matter. If you're not working on your posture, none of that will matter, because you're not conditioning your back to be in alignment and to be in its natural position where it needs to be. So more tension leads a trail of pain, not only focused to your lower back, but to your upper and middle. When all your muscles do their part and work as a whole unit, it reduces the stress on your ligaments, holds your spinal joints together, minimizes likelihood of an injury happening again, or if it hasn't happened yet, allows muscles to work more efficiently, allows your body to convert less energy, prevents muscle fatigue, less muscle strains, overuse disorders, back and muscular pain. For women who are pregnant, you should avoid slouching as much as possible, because it can cause more pressure on the internal organs. And how to correct it, I talk about it here. First, your body may feel awkward adjusting to a different stance because your muscles have not been conditioned. Talking about muscle imbalances, which I'll carry on to the end, so stick with me. And they don't know otherwise. Developing day-to-day habits to correct it are the way to go about it. But you're probably asking, how do I do that, Michael? How do I go about it? So I'll talk about this a little bit more going forward, aside from just sitting down. So some of these right here are like the plank exercise. It's one I like doing. Planks, bridges, back extensions, which I'll cover. Plank exercise, there's videos in here, tutorial videos. I have my own as well too, that are in other places too. But here you can go ahead and use these different ones. And these are great stretches. Even if you do yoga, that's very good. And it all depends. It's all about relativity on where you are in your condition. Are you somebody who has a degenerative disc? That's the only problem you have. Is it that with herniated, thinning, bulging? What is it? Everybody is at a different stage, so there's going to be a different technique for everybody to start off with and move forward with. Okay? So common mistakes. Why do you have poor posture? Wearing high heels for women. Wearing high heels. This is a commonality that happens with a lot, and people that I see, like my mom, for one example, and she has back pain too, and she has pain when she has to hunch over and grab the stuff out of the laundry mat. So I have had to make that easier for her, stuff like that. So too much weight in the stomach, again, you're leaning forward. Daily activities cause that. Pregnancy results in lordosis. Spine is lordosis. You'll see more of this right here. Correctly with this, hip flexor stretches, standing thigh stretch, planks, and I have links to these too, so you can click on them and go watch them. So here's like a normal spine, cervical, thoracic, and then lumbar, and then you have the pelvic, the bottom. and then the thoracic vertebrae from T1 to T12, and then the lumbar vertebrae, there's 5 of them, L1 to L5 that you can go through on the top side. How do you correct them? You do them with back extensions, chest stretches, planks, like I just kind of went over. Don't lean on one leg. This is the most comfortable position of all. Doing all this will result in lower back pain and hip pain because all the pressure is to one side. You don't use your muscles and buttocks to support you. So if you're just using it's like when you get, it's kind of hard, but when you have a muscle imbalance, only one side of your body works harder than the other. Or it's like one muscle side on one side works more than the other side. So you can correct this with bridges, planks. The videos are here too. Those will help you correct that, get that muscle back in alignment, help you get your spine straightened out. I like bridges a lot. They work very well. And they're also, here's a pro tip, they're also very helpful for a herniated disc, okay? Don't hunch back and text, millennials, get off your phones. And I know a lot of the more adult demographics do this as well. So don't hunch over looking at your phone. If you're gonna do it, be in a straight position. And what's always helped me is having glasses on because I can always see things better instead of like having to lean in on something and I can't see it. Because that's always the first natural movement. How to correct things, do chest stretches. Lift up your neck, tuck in your chin. And then I have a related post. If you want to know how to do this at work, you can also click there. How time doesn't play fair to anybody. What does time and pain have to do with each other? Simple. Pain occurs over time. Like mentioned up above, your movements are your everything. So you have to use them wisely, okay? Your movements dictate your posture, not the other way around. So sitting to worry less about how you are going to twist, how you're going to move your body one way versus the other will also affect your posture. So the way you subconsciously think about things and the way that time comes into play, they're major factors. So it's like saying that if you have very bad pain and you're going to work, what is going to happen? You're not going to be concentrated. You're not going to be focused. You're going to be thinking too much about things, and time's going to be wasted. And you might start getting things, you might start doing your job or certain tasks, but it won't get done efficiently in the time that it needs to be, in the allotted time. Avoid standing still and move into different standing positions. So if you have like a standing desk or if you're just standing up, don't just stand in one position. Move around a bit. That will cause you to become more flexible, and it'll cause you to have that more strength coming forward. You only know these things through trial and error, and that's how I figured it out. And I wouldn't be in the position that I am now, which is healed. I feel much better now. And, to hear more about me, you can also visit my site. I'll have an About Me page and stuff like that. But really, what I was figuring out going through trying different subjects, different painkillers, different conservative treatments, heating pads, all these different things, they gave me good relief. I got short-term, some long-term relief. And the inside, I really wanted something different. I wanted to change. I had family members looking at me. I had friends and family. I wanted to get back to my daily activities. I was thinking about what would it feel like if I didn't have those things anymore, if I couldn't get up and walk again, if I couldn't get up and enjoy a little game of soccer, or I couldn't go to just a simple thing like going to the grocery store. Imagine if I couldn't have just done any of those things. And because of trial and error, I was able to figure out how to do those things. Medical equipments, chiropractors is kind of where I go into this. And so I talk about kind of like weak correlations at this part, where from exercising to job wellness, how those things can lead into you having poor posture. Even exercising can, if you're not doing the correct one. Smoking is a given. That's one you want to stay away from because it will cause you to become 20 times faster, more dehydrated, like when we talked about water. And it'll also cause you to start curving your spine a lot more and get your spine out of an alignment. More coughing usually tends to lead to more hunching and things like that. Stress, day-to-day activity, job wellness. Does your walking, let's kind of talk about how walking should look like, what you should be doing, how to keep your chest forward, and not worry about posture, okay? Don't worry so much about poor posture. It can be a waste of time trying to figure out why your posture is even bad to begin with and try to correct them to prevent any further pain. Does this mean you shouldn't worry about your posture when you're taking a seat on the couch, on your chair, laying in bed, or during exercise? No, not exactly. Here's what you can do to understand your posture in any given situation, along with any example for each. So really what I just said there is stop thinking about it so much subconsciously. It'll come in time with the education that you get yourself with and understand. So work on your overall movement. I spoke about that earlier. When you're standing, make sure you're moving, sitting at your desk. And I have other videos on what you should be doing when you're sitting down. I talk about one of them, which is like bending over like this to the side of my chair. And that's when I talk about, which is the quadratus lumborum muscles that you're working out. So you might want to view that video too. Yoga is exceptionally the best. Okay, you need to understand stretching, because with yoga, outside of just exercises, is it's going to work on breathing, and it's going to work on getting your spine in the right spots, muscle strength, flexibility, posture. Okay, there's different kinds of yogas. It helps you with mindfulness, breathing, strength and flexibility, movements, and mobility. And there's more articles you can go and visit that have different stuff on yoga. Practice better sitting habits. Okay, I spoke about that a bit, so I'll kind of leave that there. You can check things out like at work and have other ways of ergonomically looking at it. Change your posture, okay? Think about the different situations that you're in, like one, standing in line. I gave you an example here, standing with a group of buddies taking pictures, pregnancy, right? You got to be careful about that, and how to keep your spine straight. Fixing lordosis is in there. Different assessments that I talk about. Your eyes should be level with your shoulders, ears, hips, and knees. Assessment number 2, slightly forward at your neck and lower back. Slightly back with your upper back in there to be a normal curve in the spine. I talk about kinetics, which something else I won't go into in this one. Posterior, anterior, pelvic tilts, how to do that, how to correct them, how to maintain your best posture, rewinding and aligning, so kind of reverse engineering how you got to where you got to. I talk about that more here. How to do this at work, how to sit and travel when you're traveling. I have some examples here of what I use. Lumbar cushions, I talk about pressure relief. There's some more videos about me here. Lifting weights, how you should do this when you're doing it. And this is going to be one of the biggest things you can give yourself, is lifting a weight to strengthen a muscle imbalance, right? Working on not one side that's already strengthened, but working on a side that needs strengthening. Walking with your head up. So if you're taking that afternoon walk or whatever time that is with your spouse or just yourself, whoever it was with, keep your head forward. Make moves through better posture. So here are the 3 long-lasting tips for greater posture that I wanted to get to. Thanks for sticking with me for so long. So tip number 1, set up an ergonomic environment. First and foremost, this is something that everybody misses. Even I missed this at the very beginning, is not being able to see, okay, like if I'm sitting right now here, okay, my phone is probably next to me. My glasses case is right next to me, but are they in touching distance? Are they at a spot where they're too far for me to reach? Is this laptop too far? You know, am I sitting in the right positions? Is the things around me, the environment around me, safe enough? So you got to set up these ergonomic environments to help you, and have an article on that you can get access to. Tip number 2 is just to be ready. It sounds self-explanatory, right? They are, but it's making it happen isn't so. Okay, so it seems like it, but you have to digest the knowledge to know these things, right? You have to become information aware before you become solution aware. So understand the information, digest it, so then you can use it and take action. Don't just digest information, take action on it. So digest it, take action. Keep that in your mind. Knowing your treatment options, before you walk into a situation, ask yourself, how am I feeling? Okay, before you do it. Before I sat down and made this video for you, how am I feeling before that? Do I feel good enough to sit down? For how long am I going to be sitting down for, and so forth? Know your treatment options. If it's chronic back pain, kind of what you can do there. I created an article on that. It's like 10,000 word plus you can view. And my favorite one here, tip number 3, strengthening your muscle imbalances. Coming back to what I said at the very beginning, right? It's easier said than done, but we got to condition ourselves to become more than who we are. You know, you are more powerful than you think you are, even with whatever that diagnosis, those symptoms that you have, right? If I could get through it, an everyday person can, I know you can as well. I shared with this how muscle imbalances affect your body, but that getting a muscle imbalance in check will really help you go forward. And I have an article on that too, on muscle imbalances that you can get fixed, how to fix them. Um, for one, you can get in the gym and use weights to strengthen the weaker side of your body, as I spoke about earlier. But what if you can't jump into a workout mode right now? Start doing little things like walking, even swimming will strengthen your leg muscles, joints, and will force you to keep your back upright. And ultimately, inflammation will come about less and less, and you'll have less pain. To add on, I made a free article, okay, where you can see that on fixing a muscle imbalance. And there's also one of my #1 recommendations on how to strengthen your muscle imbalances. It's a program. It's one of my favorite programs that I tried out once, and it really helped me for the long term. And I think it's the best one that there is out there, because you don't only get certain exercises on how to create better posture, but how to do this in like 7 days or less, in like 16 minutes, 17 minutes or less, and things of that nature, how to break them down into like 2-minute exercises and stuff like that. And all these little things you can do day by day with training that you can view to get to where you want to get to. So I'll have a link to that down below, and it'll also be in this article so you can check it out, the exact program that I'm talking about, and just get more information about it and how it can be very helpful for you. It can be faster, and it can help you get relief that you want long term naturally. Okay, so that's in here. I thank you for going ahead and watching this video. Hopefully you got a lot of value out of it. I can only cover so much in a video. Check out my resources. All my free resources are in here. Get my PDFs if you want them. A lot of people have been finding great success with them. They like them. I've been getting great feedback from them. And this article will be linked down below in the description, so make sure you check this out and all my other videos and stuff from removebackpain.com. Okay, so that's everything from me. If you have any questions, comments, concerns, do leave me one down below in the description, and I will go ahead and get back to you as soon as I can. Thank you very much, and I will talk to you at another time.